We're going to now launch into just Monterey County here, and then in terms of our resources.
So good morning, everyone. My name is Keisha Lopez. I am a social worker for the health department, but I'm also a board member for this nonprofit organization here. So I am sad to know that Melissa's not here, so I'll go ahead and relay the information. So Parenting Connection offers many services, but the services specifically that I want to share with you guys today is our postpartum warm line that we offer. So if you come in contact with a client, with a patient who is suffering from postpartum depression, the first step would be to contact this telephone number so that they can get a screening. Once they get screened, then one of the counselors will try to connect to a therapist in the community, or they will also share information about the postpartum support groups. And we have one in Pacific Grove, one in Marina, and one in Salinas. So if you go to the website, there's a tab that says Maternal Mental Health, and it will show you the days and the times of these postpartum support groups. If you have any questions, I think Melissa would probably be the best person to ask. And you can also contact her in that email or that telephone number as well.
Thank you so much. That's great. Okay. And while, let's see, I next want Zanelle, if you would come on up.
Good morning. My name is Zonelle Cantu. I'm a supervising public health nurse with Monterey County Health Department, and I'm here just to briefly talk about Nurse Family Partnership, which is actually a resiliency program to strengthen families in Monterey County. Nurse Family Partnership is a resiliency program, and it's to strengthen families in Monterey County. So just briefly, this is a quote by Dr. David Olds, who's the founder of Nurse Family Partnership. There is a magic window during pregnancy. It is a time when the desire to be a good mother and raise a healthy, happy child creates motivation to overcome incredible obstacles, including poverty, instability, or abuse, with the help of a well-trained nurse. The goals of Nurse Family Partnership are to improve pregnancy outcomes, to improve child health and development, and to improve economic self-sufficiency of the family. This program is delivered by public health nurses in Monterey County who provide case management services to low-income women that are pregnant for the first time with their child. And these services are provided to pregnant women that are less than 28 weeks pregnant. This program, again, is a nurse case management model program. There's specially trained nurses in Nurse Family Partnership. It is proven there's extensive and compelling evidence. From 3 randomized controlled trials, the results for Nurse Family Partnership showed healthier pregnancies, reduction in child abuse and neglect, and improvement in cognitive and language development for children. This is an intensive program. Services are opened up to first-time mothers who are less than 28 weeks pregnant, and is continued until the child is 2 years old. It is also timely. We are providing services and interventions in the first 1,000 days. The first 1,000 days, early experience influences the developing brain and this is a critical time in the first 1,000 days. There's also toxic effects of chronic stress can influence the developing brain as well. This early adversity can lead to lifelong problems. However, early intervention can prevent consequences. And one of these ways is to provide a stable, caring relationship. And again, this is essential for brain development. And here we have a graph of the human brain development. This is, again, showing the first 1,000 days. There is huge sensory pathway development. That's for vision and hearing, language development, and also higher cognitive function. And so Nurse Family Partnership again, is providing case management services and interventions into this critical period of the first 1,000 days of the human brain development of a child's life. Please, this is my contact information, my email, phone number. Again, the mission statement for Nurse Family Partnership is to positively transform the lives of vulnerable babies, mothers, and their families. And the vision is a future where all children are healthy, families thrive, communities prosper, and this cycle of poverty is broken.
Thank you so much. I think you have one more slide. There we are. And in the back, we do have materials from the Nurse Family Partnership, and I'm going to ask Julie to come on up.
Thank you. My name is Julie Cooper Altman. I'm a professor of social work in the Masters of Social Work program at CSUMB. Some of my great students are here in the audience today. But I'm here today specifically to speak about my role as a member of the Maternal Mental Health Task Force in Monterey County. As many of you know, there's over 1,000 women each year here in our county who suffer from postpartum depressive symptoms. And our rate in this county is really much higher than other similar counties in California. So about 2 years ago, our task force began, and we have, as many others, the goal of supporting the resilience and wellness of pregnant and parenting moms and their families and the community in really 3 different ways. One is through outreach and awareness. So I hope you've heard of us because we're working very hard the last few years, primarily to decrease the stigma that is often associated with maternal mental health. One of the ways in which we've done this is through the infographic that I think was in the packet, right? Just talking a little bit about the common problem and some resources around that. The second way in which we have worked is through increasing community support and collaboration among community partners, and that is often done through training and collaboration and our monthly meetings. And the third way in which we've worked so far is to promote better and more consistent access to behavioral health services, hopefully through more uniform and consistent screening. And to that end, we have worked, as you've already seen, with the Pathway to Care flowchart through Beacon, as was presented earlier, and also the Medi-Cal triage tool that is just hot off the press. It's not in the packets, but we can share that with you if you go to the Maternal Mental Health Task Force of Monterey County. That helps providers look at the acuity of the mental health condition through some screenings that we recommend, and then the resources that match that level of need. So it was a delight to be here and to have the presenters, and thank you for that moment.
And again, Julie, your task force is the Monterey County Maternal Mental Health Task Force, correct? And people can Google that and find you. Can I just say that collaboration between all of you and us getting to know each other is really the key to better care. And it's our kids, our families, our moms, our dads, our parents, our families, our schools, our community. And thank you so much to our incredible speakers. I think we were really honored and gifted by the 2 of you. Thank you. We hope to see you again and work with you more closely. Thank you to our audiences in all 3 counties. We want to work together to make our communities healthier. Thank you so much. And any questions? Your CME all your evaluations go as you walk out the door. If you are getting CEU credit, you have to sign out as well, not just in and out. And for those of you getting online training, you're watching this after the fact, please fill out your evaluation forms. Thank you.